Do you often experience bloating, discomfort, or digestive issues? Constipation is not just an inconvenience, it can impact overall health, especially in older adults. This common condition occurs when the digestive system slows down, often due to a low-fiber diet, insufficient water intake, or lack of physical activity. But don't worry, once you understand the causes, you can effectively improve the condition with simple changes to your diet and lifestyle. Welcome to Harmony for Health. Today we will help you gain a deeper understanding of constipation, from its causes and symptoms to the right diet and when you should see a doctor. Let's dive in. If you or a loved one are experiencing any of the following symptoms, your digestive system may be struggling. Having fewer bowel movements than usual, less than 3 times per week. Hard, dry stool that is difficult to pass. Feeling like you haven't fully emptied your bowels after using the restroom. Pain or discomfort during bowel movements. Bloating and abdominal distension, causing a heavy sensation. Nausea, loss of appetite, and reduced interest in food. Persistent, dull, or cramping abdominal pain, affecting daily life. Why do you experience constipation? Constipation isn't just a temporary issue. It can be a sign of unhealthy habits. Here are some common causes: lack of fiber, a diet low in vegetables, fruits, and whole grains. Insufficient water intake. Dehydration makes stool dry, hard, and difficult to pass. Lack of physical activity. Sitting for long periods and a sedentary lifestyle slow down bowel movements. Stress and anxiety. These can disrupt the digestive system and affect bowel regularity. Ignoring the urge to go. Holding in bowel movements can weaken natural reflexes, worsening constipation. Side effects of medications. Some pain relievers, diuretics, and antidepressants can contribute to constipation. Can diet help relieve constipation? The answer is yes. With just a few simple dietary adjustments, you can support your digestive system and naturally improve constipation. Dietary solutions for relieving constipation. Fiber is essential for digestion and comes in 2 main types, each playing a crucial role in maintaining bowel health. Soluble fiber, found in oats, apples, oranges, and pears, acts like a sponge, retaining water in the intestines to soften stool and facilitate smoother bowel movements. Meanwhile, insoluble fiber, present in fruit peels, leafy greens, and whole grains, increases stool bulk, stimulates bowel contractions, and promotes efficient waste elimination. However, fiber alone is not enough. It needs adequate hydration to be effective. Without enough water, fiber can absorb all the available moisture in the intestines, making stool even harder and exacerbating constipation. Therefore, it's crucial to drink 2.5 to 3 liters of water daily, along with diluted juices or herbal teas, to keep your digestive system functioning optimally. Foods that help improve constipation. Fresh fruits, a natural source of fiber and hydration. Fruits are rich in fiber, vitamins, and minerals that support digestive health. Some fruits are especially beneficial for relieving constipation. Pears, high in both soluble and insoluble fiber, pears contain sorbitol, a compound that draws water into the intestines, softening stool and easing bowel movements. For maximum benefits, eat pears with the skin on. Dragon fruit, packed with prebiotics, it helps nourish gut-friendly bacteria, improving digestion and reducing bloating. Enjoy it fresh or blended into smoothies. Apples, rich in pectin, a soluble fiber that supports gut bacteria, strengthens the immune system, and aids digestion. Keep the skin on for maximum fiber intake. Citrus fruits, oranges, tangerines, grapefruits, high in water content and naringenin, a natural compound that promotes bowel movements. Be sure to eat the white pith as it contains the most fiber. Kiwi contains actinidin, an enzyme that helps break down protein and stimulates bowel movements. Enjoy it fresh or pair it with yogurt to boost gut-friendly bacteria. Prunes and other sorbitol-rich fruits. Known for their strong laxative effects, prunes help promote regular bowel movements. Probiotics, balancing. Gut microbiota. Probiotics play a crucial role in maintaining digestive health and preventing constipation. Foods rich in probiotics include yogurt, kefir, fermented milk, sauerkraut, kimchi, and kombucha, fermented tea. For best results, pair probiotics with fiber-rich foods to help beneficial bacteria thrive in your gut. Leafy greens, natural fiber for healthy digestion. Leafy greens are an excellent source of natural fiber, promoting bowel movements and easing constipation. Some of the best options include spinach, broccoli, and arugula. To preserve nutrients, eat them raw, steamed, or blended into juices. Legumes and whole grains, small but fiber-packed. Legumes, lentils, green beans, chickpeas. Rich in fiber, they help stimulate digestion and regulate bowel movements. Add them to soups, salads, or daily meals. Whole grains, whole wheat bread, oats, brown rice. Essential for maintaining a healthy digestive system. Unlike refined grains, such as white bread and white rice, which slow digestion and may cause constipation, whole grains provide essential fiber for gut health. Important dietary tips. A well-balanced diet plays a key role in preventing and managing constipation. Combining fiber, water, and probiotics is the key to keeping your digestive system functioning properly and maintaining overall well-being. Foods to avoid to prevent constipation. While consuming fiber-rich and hydrating foods is essential, limiting foods that contribute to constipation is equally important. Here are some groups of foods to avoid or reduce. 1. Processed foods and refined carbohydrates. Highly processed foods such as white bread, white rice, pastries, and refined pasta contain little fiber. Regular consumption of these foods can slow digestion and lead to constipation. Instead, opt for whole grains like brown rice, whole grain bread, and oats to ensure an adequate fiber intake. 2. Foods high in saturated fats. Deep-fried foods, fast food, and greasy meals can slow digestion, making stool harder and more difficult to pass. These foods not only strain the digestive system, but also contribute to overall poor gut health. Serious consequences of chronic constipation, metabolic disorders, and increased risk of chronic diseases. When waste accumulates in the intestines for an extended period, the body not only reabsorbs water, but also risks reabsorbing toxins. This prolonged condition can trigger inflammatory responses, increasing the risk of chronic diseases such as type 2 diabetes, hormonal imbalances, and obesity. Additionally, metabolic disruptions may affect blood sugar regulation, making it harder for diabetics to maintain stable glucose levels. Digestive dysfunction, the vicious cycle of constipation. Constipation is not only a symptom of poor digestion, but can also worsen over time. When waste remains in the intestines for too long, the colon may become less responsive to natural peristaltic signals, reducing bowel movement efficiency. This can lead to chronic constipation and, in severe cases, megacolon, where the intestinal walls stretch and lose their ability to contract, making treatment more complex. Increased burden on the liver and kidneys. The large intestine plays a role in eliminating toxins from the body. However, when stool remains in the colon for too long, toxins may be reabsorbed into the bloodstream, placing extra stress on the liver and kidneys. Over time, this can lead to conditions like fatty liver disease or inflammation, as well as a decline in kidney function, increasing the risk of chronic kidney disease. Impact on mood and quality of life. Chronic constipation affects not only physical health, but also mental well-being. Persistent bloating and discomfort can reduce concentration, cause irritability, and lower productivity. Studies show that gut microbiota plays a crucial role in regulating mood. An imbalance in gut bacteria due to constipation can disrupt serotonin production, the hormone responsible for maintaining a positive mood, potentially leading to stress, anxiety, or even depression. Higher risks for the elderly and pregnant women. In older adults, prolonged constipation can put excessive pressure on the spine and pelvic bones, increasing the risk of herniated discs or fractures, especially in those with low bone density. For pregnant women, chronic constipation can lead to preterm labor or fetal development issues due to increased abdominal pressure. When should you see a doctor for constipation? Mild constipation can often be managed with dietary and lifestyle changes, but medical attention is necessary if you experience severe abdominal pain or persistent bloating, which may indicate a bowel obstruction or a serious digestive issue. Blood in stool or unusual stool color, which could signal gastrointestinal bleeding or other serious conditions. Test to determine the cause of constipation and how to prepare. When constipation persists or is accompanied by severe symptoms, doctors may recommend certain tests to identify the underlying cause. Below are common diagnostic tests along with preparation guidelines to ensure accurate results. 1. Colonoscopy. Purpose: examines the entire colon to detect issues such as inflammation, polyps, intestinal narrowing, or colorectal cancer. Recommended if you have blood in your stool, a family history of bowel disease, or unexplained chronic constipation. Preparation: follow dietary restrictions. Consume a low-fiber diet for 2 to 3 days before the procedure, and stop eating solid foods about 24 hours before. Only drink clear liquids like water, broth, or pulp-free juice. Take prescribed bowel cleansing medication. Your doctor will provide a laxative or bowel preparation solution, usually taken the night before the procedure. Avoid alcohol and dark-colored drinks. These may interfere with the results. Arrange for transportation. If sedation is used, you should not drive home afterward. Note: if you have underlying health conditions or take anticoagulants or diabetes medication, consult your doctor for specific instructions. 2. Abdominal X-ray. Purpose: assesses stool accumulation in the colon and detects intestinal obstruction or colonic distension. Recommended if you experience severe bloating or suspected bowel obstruction. Preparation: no strict fasting required, but avoid greasy foods, dairy, and coffee to ensure clear imaging. Inform your doctor if pregnant. Pregnant women should discuss alternative options. Remove metal objects. Items like belts, watches, or necklaces can interfere with imaging. Note: if a contrast X-ray is needed, you may need to fast for a few hours before the test. 3rd intestinal transit test. Purpose: evaluates how quickly food moves through the digestive tract to diagnose motility disorders. Recommended if chronic constipation does not improve with a high-fiber diet or laxatives. Preparation: maintain a normal diet. No dietary changes are needed, but keeping a food diary can help with evaluation. Avoid laxatives. Refrain from taking laxatives for 3 to 5 days before the test, as they may affect results. Plan ahead. This test typically requires monitoring over multiple days, usually 3 to 5 days, so schedule accordingly. Note: if you have a history of intestinal surgery or specific digestive issues, inform your doctor for personalized guidance. Not everyone with constipation needs these tests. If you are concerned about your condition, consult a doctor for the most appropriate evaluation and treatment. Conclusion: taking care of gut health not only alleviates constipation, but also plays a crucial role in improving overall well-being. A healthy digestive system enhances nutrient absorption, strengthens immunity, and reduces the risk of gastrointestinal diseases. Maintaining a balanced diet rich in fiber from vegetables, fruits, and whole grains, along with adequate hydration, supports smooth digestion. Additionally, incorporating probiotics from fermented foods like yogurt, kimchi, or kefir helps balance gut microbiota and boost natural immunity. Beyond diet, lifestyle habits also have a significant impact on digestive health. Engaging in regular physical activity, managing stress, and establishing a consistent bathroom routine contribute to optimal gut function. By making small yet effective changes in daily habits, you can support long-term digestive health and overall vitality.